everybody. I'm Pam Maragliano, Chief Editor for Dental Economics Magazine. I'm here at the Greater New York Dental Meeting with my friend Neville Hatfield. Neville, how are you?
I'm doing very well. How are you?
I'm so well, and I'm so excited to have this conversation with you. You have been using ACTIVA BioACTIVE Bulk Flow for about a year now.
Yes.
Tell us the scoop. How is it?
So I have fallen in love with the material in a way I've not fallen in love with the material in a very long time. I feel like it hits so many boxes for me, or checks so many boxes, and I just really appreciate all the little nuances that it brings to my practice. And I feel like it makes my life easier and faster and better for my patients.
So we see a lot of different types of patients. We see a lot of different types of restorations. When is this a material you're going to reach for?
So first and foremost, ACTIVA BioACTIVE line has bioactivity in it. It releases calcium, phosphate, and fluoride, and what I call the trifecta, which is super effective for any one of our patients, but it's most specifically really great for our high caries risk patients. So first and foremost, that's something I think of is the caries risk of my patient. That is a big indication of why I would use ACTIVA BioACTIVE Bulk Flow. Another reason I would use it are hard isolation cases in the posterior. Maybe we have a lot of periodontally involved teeth with deep carious lesions that we need to fill. So those are the main two patients I really jumped to this material for.
I have to bring up the delivery system. The tip of the cannula is really long, and I feel like you're going to be able to reach areas that you might not feel like you could reach well with, say, a condensable composite or other type of injectables.
Yeah, so I agree. I think the delivery system itself is amazing, and the fact that we have this cannula, it can bend any which way you want, 360 degrees, and I can even do a deep DO on number 15, which we all love to do, right? And I can really reach it and get the material where I want it to. So that's really great, and it also allows for a precise placement without having to sacrifice your comfortable hand position. So because it's bendable, that's really beneficial to it. The other thing I'd like to point out is this is a dual cure composite, meaning that it will self-set even if your curing light doesn't reach those hard to reach places. So it will eventually set by itself.
That's awesome. So I know a lot of people are familiar with ACTIVA BioACTIVE Restorative versus ACTIVA BioACTIVE Bulk Flow. When would you use restorative over bulk flow, and would you share the differences between the two?
Absolutely. So ACTIVA BioACTIVE Restorative was their first iteration of this material, and it's been around for over 10 years now, and it's really great. I really jump for that material still, even though it's an older material, because it has different uses in my hands. ACTIVA BioACTIVE Bulk Flow was their answer to, as well as just getting a self-leveling composite that can really get into all the nooks and crannies without having to necessarily deliver that material into the exact place you need it all the time. So it kind of helps the clinician, but it also helps the patients with patient selection choices. So ACTIVA Bulk Flow I now use in Class 1s and Class 2s almost all the time. Those are my main two indications I use them for. You can also use them for buildups if you want to. Now on the flip side of ACTIVA Restorative, where that was different is that it's more of a viscous material, and you can kind of place it on vertical walls and not have it slump everywhere. So every single time it's a posterior Class 5, I go for ACTIVA Restorative for that exact reason. Bioactivity is really important in those situations, as well as making sure that it stays in place and doesn't kind of slump out, versus bulk flow being a lower viscosity, versus ACTIVA Restorative is really kind of place it, cure it, you can take your time.
So I have to ask you, I've played with a lot of materials, but the real proof is when the patient comes back for recall, how are these restorations holding up? How do they look radiographically? And how do they hold up over the long term?
So I've also been using these materials for 7+ years now. These materials are really great because on recalls they look amazing, especially with those high caries risk patients or those deep carious lesions on periodontally involved teeth. You don't see any difference between where the tooth starts and the restoration begins. Obviously there's a different radiopacity there, but you can certainly see that. Intraorally, when we look and we do our recall examinations on hygiene patients, I'm not noticing any brown staining around the edges of the composite, which is obviously the first step to recurrent decay. And when we see those, we know that we need to start replacing composites. With this bioactivity in these materials, we really don't see that type of recurrent decay happening.
That's amazing. I know that sometimes we go to recall, you see a composite, you're like, I hope I didn't do that one.
Yep. And then you check back and you're like, oh, and then you feel really good when it's not yours, right?
Exactly. Or on the flip side, you see it and you're like, that one's pretty bomb.
Yes.
And that's awesome when those are ours.
Absolutely. We always love to see those.
Most definitely. Well, I know you're busy, and I know you've got all the places to be. I love the time we had together. Thank you so much for your time.
Thank you, Dr. Pam. Really appreciate it.
Thank you. All right, everybody. We'll see you all next time.